Welcome back to the Bryan Laskin Podcast. I'm Bryan Laskin, and this is a conversation about care. In the last episode, we talked about the trade that we never agreed to, how healthcare has slowly chose convenience over consent. Certainly in dentistry we have, right? Now we made things easier to process, but harder to understand. Today, we're going to stay with that idea, but focus on one specific thing: explanations, clarity in how we talk with our patients. Because before consent disappears, before trust erodes, before patients disengage, explanation goes optional, right? That's why we have eroding trust, patients disengagement, because we're not explaining well. There was a time when explanation wasn't something you added to care. It was actually care itself, not a step, not a form, not a legal requirement. It was how people understood what was happening to them. Patient expected explanations, not perfection, not dental school, just orientation about what was going to be done, what's happening, why it matters, and what comes next. But clinicians are expected to explain, not because it was required, but because it was understood as part of being a caregiver. If you actually care, you explain. It wasn't efficient, but it was grounding. And that didn't disappear because people have stopped caring. As we've talked about before on this podcast for years, but specifically last episode, this isn't due to people not caring. Caring for people is very different than making people feel cared for. But this feeling and listening to people has disappeared because the system has changed what is rewarded. We began optimizing, particularly for speed, for documentation, for risk mitigation. Now, none of these are bad in and of themselves, but when they become dominant, they reshape our behavior. Explanation starts to feel for us like friction, something that slows us down, something that wasn't billable, something that increases questions instead of closing loops. Now, it didn't get banned, it got deferred. We think, well, if there's time or if they ask or someone else handles it, but this isn't about taking more time, as we'll talk about later. And here's what has subtly happened. Explanation has become confused with consent. We told ourselves that if someone signed a form, they must understand. If they nodded, then they probably agree with us. If they didn't ask questions, then they must feel comfortable. But silence isn't understanding, and compliance isn't clarity. Informed consent slowly became procedural consent, a signature instead of a conversation, a checkbox instead of comprehension, of understanding of what's going on. Explanations haven't disappeared, they've been replaced. And here's what it feels like from the patient side. Most patients don't feel confused in the moment, they feel embarrassed. They don't want to interrupt. They feel embarrassed to ask what they might think is a dumb question. They might be embarrassed to slow down a system that clearly wants to keep moving. So they gloss over and they look at you with glossy-eyed faces and they nod and they sign the consent form and they just go along. Not because they understand what we're doing, but because they don't feel permitted to pause. And then later, that confusion turns into anxiety, which is a massive problem in our industry, because that anxiety then turns into mistrust, and mistrust turns into disengagement. But it didn't start off as disengagement or resistance. It started off as silence. Now look at this from the clinician side, from our side. Dentists know that explanations matter. They always have, but they're practicing inside a system that rewards explanations as being optional and punishes delay. Schedules are tight. We're all busy. There's a backlog of a lot of offices that's very real. The pressure is constant when you're seeing 2 patients, 3 patients at a time. So dentists have made a trade-off, not because they don't care, but because the systems forces us to choose between depth of conversation and moving on to the next thing. And over time, that creates a quiet fracture, right? Because the burnout that many dentists feel isn't just fatigue, it's moral compression. Knowing what the patients need and want, but being trained, rewarded, and scheduled away from providing it. When explanations degrade, everything downstream suffers, everything. Patients don't remember what we said because they didn't even hear it the first time, frankly. They don't follow through. They miss appointments. They decline care. They seek second opinions, not to shop, but they want to understand. I'm going to say that again. When people shop for another opinion, it's likely not to shop, it's to understand what's going on. And we label that behavior as non-compliant, unmotivated, difficult patients. But the uncomfortable truth is what we call patient compliance is often system non-explanation. We haven't designed in our systems how do we explain to people, because the first time they're probably not listening, right? They're probably, oh my gosh, I can't believe I have to do this. So we have to develop systems that explain things and repeat things. Explanation is not about time, not more of your time. It's about intention. It's about whether understanding is treated as essential or optional, whether understanding by our patients is treated as essential or optional. Explanation is what turns care into something people can carry with them. Without it, care becomes something that only exists in your operatory, in your rooms. And care that only exists in the room doesn't survive reality when the patient goes home and they have other bills to pay and other things to do. We often say patients need to take responsibility of their own care, but responsibility without explanation isn't empowerment, it's abandonment. And people don't understand what's happening to them. They can meaningfully participate in their care when they actually understand what's happening. When participation disappears, trust goes away with it. So this episode isn't about blaming dentists, because dentists have so much going on, right? It's not about blaming patients who are confused. It's about naming a design failure in our systems. So systems that we've built that have made explanation and understanding optional. And then we act surprised when our trust is eroded, which it is. Care hasn't disappeared. Clarity and explanations have. And once explanation is restored, everything else will get better. And as explanations go away, everything becomes harder. So the last episode, we talked about convenience over consent. This episode is about explanation becoming optional. Next time, we're going to talk about what happens when documentation replaces conversation, because once explanation disappears, paperwork takes its place. Oh man, is that fun. And that trade has consequences that are massive too. Until next time, take care.